Tánaiste, the new National Children's Hospital will be a game changer for the children of Ireland. It will be a fantastic world-class hospital. It will nearly double surgical capacity and will provide the best modern care which the children of Ireland need and deserve. I want to see this hospital built and open as soon as possible. I think that's in everyone's interest, and it is what the children of Ireland deserve. But the long-running saga of the new Children's Hospital, a fiasco, it has to be said from the start, has now descended into farce. There is no certainty about a final cost or a final completion date. There has been no honesty about the scale of the challenges which we are facing with this project. And we learned this week that the board has reached the end of the road on their original budget. They are looking for hundreds of millions of more money from government to continue this project without any indication of what the final cost will be or when this hospital might be open. And all the while, 100,000 children are languishing on hospital waiting lists. This government has made promises time and again, and you've reiterated those promises to children with scoliosis, Tánaiste, that they will get care they need within 4 months. But many, as you know, are still waiting years. These children need this hospital built and open as soon as possible. When Leo Varadkar was Taoiseach, he said, when he was Minister for Health, he said that he committed to opening this hospital by 2020, quote, unless an asteroid hits Earth. In 2019, when releasing a damning PwC report which found major underestimations of cost and extremely poor governance, the Taoiseach said it was his priority to meet the 2023 opening date. Then it became March 24, and in the last few weeks it changed again to May 24. Yesterday, astoundingly, the board could give no indication or certainty on when the hospital will be handed over. I have no confidence, Tánaiste, that this hospital will be open and ready and treating patients in 2024. I think it's a certainty now it will be 2025, and God knows when in that year. The board and the contractor are now openly at war, and all the while the costs are rising. This is in nobody's interest. It does nothing to help the children who need this hospital built. It is unseemly, it is unprofessional, and it does not inspire confidence that this government can deliver this project on time and in cost. We need action from your government, Tánaiste. We need urgency and we need leadership. What we need now is not more fictitious timeframes or costs. Every timeframe that we have been given has come and has gone. And all we can see, and all taxpayers can see, is more cheques being written, more money being spent, more cheques being written, more delays, more cost overruns. We need a real date. We need a real timeframe. And we need to do everything possible to ensure that this project is brought back on track. There is a responsibility on the Minister for Health, who is sitting next to you, to get off the sidelines and show leadership. Knock heads together, ensure that the board and BAM are doing everything possible to make sure that this project comes in on time. I'm sure you'd accept, Tánaiste, we cannot simply continue to write cheques with no guarantees. So can I ask you that, are you going to commit more money to this project without any certainty on completion date? And can you tell us exactly how much additional funding has been sought by the board beyond the €1.7 billion already committed?
Deputy Cullinane. Tánaiste.
I agree with the Deputy that the new Children's Hospital will be transformative when it is completed, and that it will represent a very significant step change in terms of tertiary care for children in this country. The opening of the two satellite centres have already had impact. And I visited the site last year when I was Taoiseach, and it is a greater degree of completion now than it would have been some years ago. And since this government came into office, it's had a very clear focus on the hospital. And that focus is about getting the hospital complete, but also getting value for money and ensuring that there was a rigorous process in terms of cost. I respect your right, of course, to raise these issues on a continuing basis. That is your job as opposition spokesperson. But I think in terms of the public debate and the history of this entire project, in terms of politicisation of the hospital or issues around cost and so on, we have to be very careful we're not playing into somebody else's hands here. And I've been very adamant from the outset, when I became Taoiseach 2.5 years ago, that we had to follow a rigorous process here. And yes, there has been tensions. There's no question about that. There's been a real difficulty here. And perhaps one wouldn't have started out again if you were starting to build a new hospital. And one of the issues is in all of these public contracts, I would put it to you, Deputy, the last thing you should do ever in terms of a public contract is to start putting costs out there. You should tender, see what comes in. And claims are being made now, but the claims are being challenged every step of the way. And that is right. And there shouldn't be compromise on contesting those claims. I mean that. And if that means delay, so be it. We should 2% of the claims, that's the outturn of all the claims that have been made so far. Why? Because they are being contested through mediation. Now, you could cut corners. You could say, let's not contest these claims, let's give more to hurry up and accelerate the completion. But that game is over. That's not going to happen, and it hasn't happened over the last 2.5 years. Contractors have responsibility. The National Paediatric Development Hospital Board has responsibilities. It is charged with delivering this project. And in my view, painful as it is, unsatisfactory as it is in terms of completion timeframes, we need to stick with the process and not create leverage for anybody to see weaknesses on the state side in terms of the state somehow going to compromise its position in a mad political rush to get this thing completed, because it might not look well if we don't get it completed before a certain time frame. I don't approve of that approach at all, Deputy. I think we have to be hard, fair. We want the hospital completed. But if claims are being made that are not sustainable, then they have to be tested. That means arbitration, it means mediation. That's slow. We know that the COVID-19 and various things have delayed the project. By definition, every building project in the last 2 years has gone up in costs. We know that through housing and everything else. That's going to feed its way into the Children's Hospital, those costs, as well as costs caused by delay. From our perspective, we want the hospital built. It will be transformative when it is built in terms of children's quality of care, and the physical environment of children's care will be transformed. And we just have to stick with it. The Development Board working with the contractors to get this done all the time, making sure that from the public interest point of view, that value for money is a key priority, and that there is cost containment as well, and that we just don't surrender to every claim that is made.
Well, I have even less confidence now after that contribution, it has to be said. I have even less confidence now after your contribution in relation to your response. First of all, I didn't put completion dates out there. You did. Your government did. Your government ministers were saying over the last number, excuse me, I'm putting questions to you. Your government ministers, including the one next to you, was talking about March of next year as a completion date, and then the department were saying, well, it could be May. I didn't put those dates out there. The board did, reiterated by the minister. Previous dates were stated by previous government ministers as well. And in terms of costs, your government approved the total programme cost of €1.7 billion. And what we now know is that the board is looking for hundreds of millions of more money. You're saying that the days of throwing more money at this project are gone. Wake up and see what's happening. Are you seriously telling me that you're not going to give any more money to this project? Because that's not what we're being told by the board. So my understanding is this will go to Cabinet. And what I'm asking you is that before any more taxpayers' money is handed over, will you guarantee that you will have a completion date that is real and realistic, not fictitious, but realistic? And let's get this hospital built, because this isn't about anybody playing politics. This is about making sure that this hospital is built for the children who need it.
With respect, Deputy, I never said anything about nobody getting any additional money. I didn't say that at all, but you just said I did, which is untrue. So don't be putting words into my mouth. You came out 2 weeks ago saying about sources that you had, saying that remedial works needed to be carried out. I would say to you, in the public interest, you should reveal the sources. What's the secret? No, hold on a second. What is the secret? If someone comes to you and says, we have information, no, you should put the source.
We did put it in the public
No, you should put the source. Who came to you? Who came to you, Deputy?
You throw whistleblowers
Because what I'm trying to say here,
we
through the
don't.
Chair, if I may,
You've a history
I'm now
of
answering your
whistleblowers under the
question.
bus.
I'm now answering
My
your
party
question.
doesn't.
I'm simply saying, in the public interest, because there's lots of agendas here.
Yeah,
I'm not talking about Juno. I'm talking about around the cost
Ronnie,
of
you want
this.
that side?
I'm talking about the cost of this. We have to protect, as best we can, the taxpayer. Right? I never gave a date on this. And the reason I didn't give a date on this is because I'm aware of the tensions between the contractor and the Hospital Development Board, which have been there now for a good number of years. There's no secret about that. And there's a way to deal with this, Deputy. And it's not in the public glare of big grandstanding statements about dates or funding.
I'm doing my job.
Time is up.
It's the nitty-gritty daily grind of contesting the claims that have been made, testing them objectively, and then doing the best on behalf of the taxpayer and
you failed in all of
the
that.
children of Ireland.
You failed in all of that.